when people discontinue antidepressants, benzodiazepines, or other psychiatric drugs, there is that period of readjustment where the changes that were caused by the drug have to then be reversed. And during that period, withdrawal can be experienced. I always say that there's an unbelievability factor to withdrawal because the symptoms are so intense and so horrific that most people don't believe that a prescribed drug could cause such a drastic reaction. But this is exactly what happens. And until the receptors that were damaged while the drug was being taken have been upregulated, people experience these symptoms that we've been talking about. When I first came off clonazepam, I met a lot of people who were also coming off benzodiazepines. I would say within the last 2 to 3 years, the number of people coming off SSRI antidepressants and other antidepressants, but mainly the SSRIs, I'm actually quite shocked. I would say that I speak to maybe 80% of the people I speak to now are coping with antidepressant withdrawal, or maybe with benzo and antidepressant withdrawal. But antidepressants, I think we need to watch that. And I think, again, just as with benzodiazepines, doctors need to become aware that they're not as harmless as they're made out to be, and that withdrawal from antidepressants can be very, very intense as well. I haven't noticed much of a difference between benzodiazepine withdrawal and antidepressant withdrawal. Both can be as horrific, both can be as intense, both can be as lengthy. I think that antidepressant withdrawal gets less attention, and this is worrying. So people in antidepressant withdrawal from their doctors, they're just told that, and they're told it's impossible to go through. I think because benzodiazepines have a longer history, there's more acknowledgement. And so I think a clear message has to be sent to doctors that, please, antidepressant withdrawal is just as horrific as benzodiazepine. It can be just as horrific as benzodiazepine withdrawal. Some doctors are becoming more knowledgeable about withdrawal, and we welcome this. Sadly, many doctors are still unaware of the repercussions, they're unaware of the duration, and they're unaware of the withdrawal reactions. I wish that every doctor would read the Ashton Manual. I really do. I think every GP needs to be trained. I've seen so many people in withdrawal exhaust the NHS's resources with all these diagnostic tests when they're just in withdrawal, and the tests are always negative. And I think if doctors knew what to look for, one, the patients wouldn't be as traumatized, because having reassurance from a doctor, nothing beats that. So my message to doctors would be, we're not a group of lunatics. We're not a group of people who are in denial. We're people who, for many of us, were put on the drugs for medical conditions, and we all ended up with the same experiences. So that uniformity means that, no, it's not in our heads, and we really need you to listen to avoid further damage or reduce harm to those yet to come. Sorry. I have worked in crisis areas. I worked with domestic violence. I now work with women and children who have been raped and sexually abused. I have never seen anything as devastating. And I'm not saying that these issues are unimportant. I'm not comparing them with benzodiazepine or antidepressant withdrawal. I'm just saying that the duration, the chaos, the devastation it causes, and the lack of support is, so I go through a myriad of emotions. I have a lot of hope because I know the outcome is going to be positive, but taking those calls every day, hearing people I care about cry and just without hope, just thinking I'm better off dead. And it breaks my heart, or it does. And I know it sounds far-fetched to say I love people in withdrawal. I have such compassion because I know how brave they are. And I just think I wish everybody could just understand that these people on the internet, and they are referred to as these people because nobody can relate to what they're going through, are the bravest people I know. And they're heroes. And yeah, I have a lot of compassion for them. I just wish in my lifetime this issue will be acknowledged and something will be done about it. When people ask me how long withdrawal takes, my response is usually not what they want to hear, but withdrawal takes as long as your nervous system needs in order to heal. The average duration of withdrawal is reported to be between 6 and 18 months. However, there are people who recover sooner and there are people who need more time. Unfortunately, I think a lot depends on how someone was taken off the drug. So you may find that people who were maybe cold turkeyed or taken off in detox centers can go through a more prolonged and horrific experience. I don't know of anyone who has been in withdrawal indefinitely in terms of 10 years or, but I would say that within 3-4 years, the majority of people are better in terms of the people I have spoken to, who, I'll just add, are people in protracted withdrawal mostly. Since my own withdrawal in 2006, I've communicated with more than 6,000 people and have supported most of them through their own withdrawal journeys. I would say that we do recover. In my experience, they all go on to get better. Some people take a bit longer than others because of protracted withdrawal, but the outcome of withdrawal is recovery. And it's always one of the joys of supporting people through withdrawal is getting that email or phone call saying, I just want you to know that the symptoms have gone and I'm better now. And it's just wonderful. An intense withdrawal can be devastating. It can impact a person's life in a myriad of ways, all quite hard-hitting. So apart from having to cope with the symptoms and this state of being unwell all the time, someone with a bad withdrawal has to then cope with the financial repercussions. So some people end up bankrupt or losing their homes. And I know it sounds quite far-fetched. It is actually true, and it's something I experienced as well. It impacts relationships, it impacts family, friendships. work, it really is devastating. It's, as I said, it's not just about the symptoms, and family members need a lot of support, because to see a loved one go through so much trauma can in itself be, well, it's vicariously traumatic. Rebuilding your life after withdrawal takes a lot of effort. One of the reasons is that most people lose their confidence. You know, they've been traumatized, for a lot of people, they've lost everything. And it takes time to regain that sense of self, even after being depersonalized, derealized for so long as well. So I think it can be a sort of gradual re-entrance into the world of activity after withdrawal, and that may entail things like volunteering, things like maybe just joining a group, and getting support, asking for help. I think people who have families who are supportive, for them it's easier. But somebody who has been isolated, who has lost all their friends, it can take quite a bit of effort to, as I say, re-enter the world and maybe resume work and even rebuild new relationships. I have seen people freak out, after reading stories on the internet, and within 5-7 months, they're fine. So the main thing is to be careful of what you ingest, what you absorb. Look after yourself well in terms of how you eat. Avoid stimulants like alcohol and coffee and monosodium glutamate, or MSG E621 as it's known. And you have to dig deep down for that will and that determination, because withdrawal can be, it can break you down and sort of eat away at you if you don't find all your reserves. So I use a lot of repetitions, or they can sound like platitudes, but they're so important, and that you have to keep going. It's about perseverance. And I say this to the people who are having the worst experiences, because there's some people who have maybe a bad withdrawal, but they have a lot of windows, and they're able to use that to sort of buffer themselves. But when it's relentless, it has to be about courage and determination, and not letting it beat you, not letting the scary thoughts take over. Somebody in withdrawal needs both practical and emotional support. In terms of emotional support, that person would need almost constant reassurance, somebody to listen without judgment and not offer solutions. And most importantly, that person would need somebody who wants to find out about withdrawal, who is willing maybe to go on to one of the groups or to read up about it, because it is quite a complex phenomenon. And I think to give proper support, one really needs to understand what it entails and how complex it is. People going through withdrawal from antidepressants and benzodiazepines experience a range of physical, psychological, and neurological symptoms. They're vast and many and varied. Some of the worst are things like depersonalization, derealization, nerve pain, intrusive obsessive thoughts, sometimes of taboo subjects or an obsession with death, suicidal ideation. You know, they're quite harmful in terms of somebody having to cope with these symptoms day after day after day, digestion problems, severe headaches and distortions. I fell in love with Wales the very first time I visited. I remember going up to the Brecon Beacons, and it's just such, the countryside is so beautiful. And Cardiff itself, although it's a city, it's quite laid back, you know, wide open spaces. I love living by the water. And the people are very welcoming, very warm. I was always a bit airy-fairy, a bit very laid back. I loved my yoga. I was either vegan or vegetarian or very health conscious. I wasn't much into drinking, you know, sort of more on a natural high. And I didn't have any addictive tendencies or anything like that. I mean, my vice was a cup of tea. I started taking clonazepam because I was concerned about a form of dystonia I was born with, which manifested in a tic of my right eye, as well as my head tilting to the left, and you know, other quirks. But it was the tic that bothered me most. And so when my then fiance, proposed, I went to my GP, you know, asking, because I was concerned that during my wedding, you know, there was no way I would be able to hide the ticking. When I first took the drug, it did help, but I quickly developed tolerance and just gradually became more and more unwell as the years went by. I started losing my memory. I couldn't complete sentences. I was spaced out all the time. And, you know, there were quite a few other side effects of taking the drug. I remember getting lost going home one day. I just couldn't figure out where my apartment was, where my flat was. And once I found my front door, I remember just going straight through to the computer, typing in clonazepam, and that was when I started my search for what was wrong and ended up finding the Ashton Manual. My withdrawal was horrific, beyond horrific. I did think I was going to die. I had about every symptom conceivable. I had terrible headaches. I had muscle pain, joint pain, tissue pain, toothache. I had burning and electric shocks. I used to see floaters. My eyes would swell shut. They were bloodshot. Every doctor I consulted during withdrawal said, no, 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 you cannot be in withdrawal. Benzodiazepine withdrawal lasts only a few weeks, 3 months. Most of them said 3 months. One said 3 to 6 months maximum. My withdrawal lasted about 3 years. After the acute stage, I started having windows, and then I noticed that I gradually had, you know, these windows of clarity when some of the symptoms would abate longer. And around 2008, the beginning of 2008, most of the symptoms subsided, and I was left with just a bit of hearing distortion and an exaggeration of the spasms. That has now all gone, and you know, I'm back to normal, completely recovered. Coping for me was about hope. I literally had to hold on to that because the symptoms were so overwhelming. So it was like daily motivating myself to not give up, not giving, you know, keep going. I spur myself on. I did a lot of breathing exercises. I grounded myself a lot. I used EFT tapping. I used just about every tool I could think of to cope. And somehow it worked. And I had this mantra, this too shall pass. When I look back at what happened, and I'm very honest when I say I hold no resentment or any bitterness towards my doctor. And I can say that because I know that they absolutely have no clue. And everything my doctors said, they actually believed. So all I can think of is how much of a blessing or how positive everything has turned out to be, my being able to help others in withdrawal. And I think more than anything for me, it's about the strength that I discovered I had and I have, and it's made me fearless. I mean, nothing phases me anymore. And I look back and I think, gosh, I got through that. I'll get through anything.
The advice we give to people going through withdrawal is to try and keep busy, to do as many normal activities as they possibly can. That may be very restricted, but any kind of social life they can manage, jobs around the house, jobs in the garden, if they can take exercise, if they can go out walking, often tends to help people. There's nothing that will take the symptoms away. But if people can manage to distract a bit, then they can get through each day, and that is really all they need to do. Well, antidepressants seem to cause just as many problems as the benzodiazepines. It's not as widely known, even amongst doctors, that antidepressants are addictive and can cause myriad problems for people who come off them. Many of the symptoms are much the same as the benzodiazepines, the anxiety and the depression and the suicidal feelings, but there are some symptoms that are particular to especially the newer SSRI antidepressants, which tend to be things like electric shocks in the head and shocks all over the body and feelings of electricity going through them. And in many cases, we found the symptoms of antidepressant withdrawal go on actually even longer than those for benzodiazepine withdrawal and withdrawal from sleeping pills. So if anything, it's an even bigger problem than the benzodiazepines, but it's not officially recognised as such yet. There is a huge range of doctors and other medical staff in terms of understanding this problem. You go from the extremely good, the very supportive, the people who will tell people to their face, like my doctor would, that these drugs are addictive and that you shouldn't go on them, but if you're on them, you should be on them only for the very shortest time, and will give people a lot of support to come off, and they will work closely with organisations like mine. And you then go to the other extreme of doctors who completely dismiss the problem and will blame the patient and say there's underlying problems, and don't give patients any sense of what is happening to them. And that's what's so frightening. If you're cut off from help and support, how can you possibly get through this? So there is the widest possible variety of doctors, unfortunately, out there. And that's one thing that needs to change in future through the training or what have you. Doctors need to be more aware and much more responsive to people going through this problem. People should come off all prescribed psychiatric drugs slowly, a little bit at a time, probably slower than they initially think. You can't rush this. If you cold turkey or if you try and go too quickly, you'll end up in severe trouble, as I know to my own cost. Go online or phone an organisation like Bristol Tranquilizer Project, and they will go through the necessary program with you. They'll give you a good idea of when to be cutting, how long it's going to take, how long the recovery afterwards will take. But to be honest, it's always better to go slowly rather than too quickly. There is no shortcut. There are no other drugs that lessen the effect of the withdrawal. You just have to go through the process. The mistakes that doctors are making in some cases, not all doctors, but some doctors are still leaving people on too long, especially the benzodiazepines. There's clear guidance, people should only be on for 4 weeks. That's an absolute definite, absolute limit, and a lot of doctors are still going beyond the 4 weeks. They shouldn't be tempted to do that, even if the people aren't better. There is no point in leaving people on benzodiazepines beyond that 4-week period. As I know, they don't work beyond that period. Other mistakes doctors are making in some cases are not understanding withdrawal symptoms, tending to ascribe them to other conditions, not understanding how devastating they are, not realizing how long they go on, trying to take people off too quickly, not understanding the consequences of that, and lastly, not understanding how long it takes for people to recover once they have come off. It's a very long process. Most people will have symptoms once they come off these drugs for at least a year, and that's more or less a minimum. A lot of people will recover during their second year, probably the majority, but there are some unfortunate souls for whom it will go on and they will take several years, but they will get better as well eventually, there's no doubt about it. But it's very hard. If it goes on beyond that 2-year period, it's very hard. It's a huge struggle for people to believe in themselves. And that's one of the ways we are able to help people, to assure them that even they will recover one day, eventually, completely. Yeah, the impact of withdrawal on people can be devastating and very often is devastating. And it ranges across all sides of their life, from their private life to their friends, to their social life, to their work life. Every single aspect of their lives will be affected. And that is what is so upsetting for people, that they lose all these different sides of themselves and they feel absolutely stripped naked. They feel they have none of their qualities, none of their attributes, none of their virtues. They are just a mass of symptoms, and that's all they are, and that's all they can ever think of being. And it's very, very hard for people to be optimistic. They have so little to go on. They're so ill. That's the job we do here, really, is encouraging people to think this will be only temporary, because if it was permanent, people would struggle to carry on their whole lives with this. It's very common, unfortunately, that while people are in withdrawal and even in post-withdrawal, doctors will ascribe many of their problems to other things, to other illnesses, and they will tend to get put on other drugs, especially antidepressants, but quite a lot of our clients have got put on major tranquilizers, which can be quite devastating, extremely difficult to come off. And it means that instead of maybe a withdrawal taking a year and post-withdrawal taking a year or two, you might be looking at 5 to 10 years for those people to get fully well. So it's a total waste of their life. These other drugs don't help. They actually hinder them. And doctors just need to be much more aware of the problems that these psychotropic drugs throw up. There are many symptoms of people going through withdrawal. Anxiety very often tends to be one of them. People also may well feel suicidal, but they can have a huge range of other symptoms, and nobody will get all the symptoms, but there's probably dozens and dozens and dozens that they could get. And some of them are very frightening. They can get electric shocks in the head. They can get severe bowel problems, stomach problems. They can have very severe loss of concentration. They can be unable to speak properly. They can't formulate words. They can't think of words, even in their heads properly. They get very socially isolated. They're not able to maintain friendships. There tends to be a lot of problems between couples because the person who's going through it is not the same person as they were before, and it's very hard for the partner to understand that and sympathise with it. So there are a huge range of symptoms and problems that this throws up. I've been working for the Bristol Tranquilizer Project really since the late 1980s when I first really started to recover. So for the last 20 years I've been doing the same sort of work, which is helping people through the tangle of withdrawal and post-withdrawal in all the ways that we're still doing. So through telephone helpline, one-to-one counselling, and through running groups. And I run a group in Bristol every week. I have done for about the last 20 years.
Good morning, Bristol Tranquilizer Project. Iris speaking. Hold the line. I'll just put you through to Ian, who can help you.
Hello. The services we provide are mainly a helpline. Most of the people we help are over the helpline, but we also do see people individually, and we do run groups. The numbers have risen till we're helping nearly 300 people a year now. Yeah, sure. Yes, I can. Yes, certainly. Can you tell me what the pills are that you're taking? And how much? My career before I was put on these drugs was working in Whitehall. I had worked in the Forestry Commission, but for several years I transferred to the Department of Trade and Industry, and working sometimes more or less directly for ministers. And I can remember running down Whitehall at 6 o'clock at night with stuff to put in their bags before they went on their trains. So it did get very stressful, working to deadlines and under pressure all the time. The drugs helped initially. They did seem to calm the stomach down where most of my problems were. And for a month I thought I was going to be okay. I went back to work. I seemed to be okay for a little while, and then I found the problems building up again. As I got beyond that first month into several months, I found a whole set of other problems. I really got to the point I thought I'm not going to be able to get off these drugs, and that's what led me to decide to cold turkey. I thought that was the only way I could survive, was to get off these drugs and try and get my life together again. But of course I had no idea how devastating cold turkey would be. The worst symptom that I had in post-withdrawal was the anxiety. That was overwhelming, completely crippling. It dwarfed everything else. It made me feel totally suicidal. It made me feel I definitely would never recover. I was going to be like this for the rest of my life. Well, it took me about 18 months for my recovery to start. In that 18 months, I was really severely ill all the time with only 1 or 2 windows. After the 18 months, the anxiety went down considerably, and that is what I've been praying for. So I always think back now that after the 18 months, I was better. Of course, I wasn't 100% better. It took me several years after that to get back to where I'd been before. And I think if I hadn't had a lot of help along the way, I probably would have taken my own life. It did seem to me it was absolutely pointless going on. The symptoms were so severe. I felt I had severe mental illness. I wasn't being discouraged from thinking that by anybody, really, until I met Val from the Bristol Tranquilizer Project. And I really thought I was going to be ill like that for the rest of my life without any prospect of recovery. And it was only when I came to the Bristol Tranquilizer Project that people assured me these were normal symptoms and that I would recover. Yeah. It's just wonderful when people do start to get better.
Hopefully it will now.
The work that I do here is the same as I've been doing for the past 20 years. It's helping people to recover, helping people to understand the problem, giving people support, and giving people encouragement that they can get through this awful problem and that they're not alone.
Right. That's it, yeah. But I mean, this year you're going to get things sorted, aren't you?
I think what people most need is reassurance that what they're going through is not unusual, that it's very much part of the pattern, And they also need to know that there will be an end to it. So it's those two things, really, making people feel they're not unusual. People always think they are unusual. They think they're going to be the only one that doesn't recover. It's giving them that assurance that other people feel the same things. They're not unusual. It's part of a pattern. And also that everybody recovers eventually. And it may take a long time, but we assure them that everybody does make a full recovery, even if it's after years.
The first bit of advice we would give them is not to come off suddenly, because the more sudden withdrawal, if someone goes cold turkey, that's medically inadvisable and will have profound effects on them, would be a horribly intense experience and it could be life-threatening. So we definitely don't advise that as the one piece of main advice we give. Providing they've taken that on board, we would suggest that they stabilise the amount that they're on. And by that I mean, in our experience, a lot of people, despite what they're prescribed, tend to up their dose at times when they feel extra stress, and then maybe try and go without on some other occasions. So we get it over to them that they need to keep the drug consistent in their bloodstream. So to decide on an amount that is manageable for them, stick to that amount for at least a couple of weeks, and then to try and gradually reduce. The advice I'd have for other family members trying to help a person in withdrawal is to have a great deal of patience and to give an incredible amount of daily reassurance. And you might find you're having to say the same thing over and over again, but the person is desperately ill and really needs that reassurance from you. Also, for your own sake, if you can take a bit of time out and make sure that you concentrate on yourself, because also the knock-on effect can be very stressful for you. If you can encourage that person to find, an organisation that specialises in this, and there are things on, online that even somebody in bed can actually use, then I would, encourage you to do that as well. There is everything wrong with coming off rapidly or cold turkey. People can have seizures and die. If they don't have that, they can have perceptual disturbances and see like the floor coming up. They can be profoundly ill for years afterwards because the withdrawal has been too rapid. And we do see people who have come out from rehabs where they've gone in, where they've been taken off in a very short period of time, and as far as the rehab is concerned, they're off their tablets, but they are still suffering profoundly. So we would absolutely strongly recommend, if anybody just takes one piece of advice away from this video, that they do not stop their tablets quickly. I don't think there's anyone that recommends that. It's the worst thing you can do. It can get so bad that people feel suicidal. Most of our clients, I'd say 95%, don't work, are unable to work. People have lost relationships through it. We have mainly older client group, and many of them have missed out tremendously on whether it was going to events at their children's school, or they describe being on a picnic but not really, they've seen the photos, they don't actually remember being there. Of the very small number of clients we have who take also illicit substances, they've all said that they found it much harder to come off this than heroin. So I think that puts it in some kind of perspective. It really is profoundly distressing for the person undergoing the experience. In my experience, I'd say that a lot of GPs, unfortunately, are fairly poorly educated around the issue of benzodiazepines. I can think of a lot of reasons why that would be, and I totally understand that in a 5-minute consultation they may be putting the person's symptoms down to a lot of other issues, but having seen so many people with that problem over the years, it's much more perhaps detectable to a service that majors in this particular area. I do go in with some clients to see their GPs if they've not accepted a letter, so I do know what the kind of attitudes are out there, and it does seem like quite a lottery if somebody's got a very understanding GP, very supportive. Otherwise, I sometimes get the impression that there's some kind of attitude that we're maybe telling the medical profession how they should respond, which isn't how I see it. I see it, we're working together with the patient to get the best result for the person. And in many cases, a GP has actually inherited someone that's been on a long-term script, so it isn't of their original making. So I think they can sometimes see it as a threatening thing from the agencies that specialise in this. Everybody that I've seen does recover once they come off. I've never worked with anybody who hasn't been, tremendously better from how they were going through the withdrawal and actually feeling better than when they were on the tablets, because a lot of people experience tolerance and an interdose withdrawal, so they actually feel quite ill all the time when they're using. So other than, these tablets to be used for the few weeks that they're recommended for, there really is no benefit to staying on them long term. What I mostly get asked is, am I going mad or am I dying? And we're able to say, well, actually, no, this is to do with the tablets. We do ask that people get medically checked because we're not medical, so we can't definitely say it's the tablets, but 9 times out of 10 it is. If they come to the support group, if they have a symptom, we had somebody who had tingling in their feet, a number of other people in the room said, oh, I've had that, and it was such a relief to them to think that it's probably to do with the tablets. So it's somewhere to come where people can identify with what you're going through, and then we can definitely say, well, yes, you would be having a hard time. And they've often received very inaccurate information about how easy it will be to come off, that kind of thing. So we can give the accurate information and the emotional support. Well, the impact on families of somebody in withdrawal can be very profound indeed, because it can be very hard for the individuals to understand that, the person is reacting as a result of the tablets. They find that very hard to believe because it was a tablet that was given by the medical profession. So where they might understand if they read an article about Class A's and the kind of dramatic effects from that, they just don't see it in the same way. So obviously it can bring a lot of, relationship tension, and often the person is just simply not well enough to do the everyday things that one might do, whether it's looking after themselves or looking after a home. If obviously I've said 95% of clients don't work, we do have some retirees, but they're not able to get out to a job. That's going to have a monetary implication. So yes, it can be extremely difficult for family members who in many cases more or less turn into a carer. What I'd like to say to doctors in order to help solve this situation is that the power differential between the GP and the patient be levelled, and within that relationship that the GP understands that the person is going through a profound experience that is causing them a great deal of pain, and there needs to be a belief about that, and there needs to be provision put in place to allow the person to very slowly and gradually withdraw from the tablets. And ideally, while they're doing that, that they have a specialised project to attend that understands what they're going through, to meet with other people that can identify with the situation. As per the BNF guidelines, we recommend a taper of 1 to 2 milligrams every 2 to 4 weeks. That's if people want to do it in a standardised way, and bearing in mind we're often writing to GPs with recommendations. But ideally, what we'd really suggest to people is that they taper at their own pace. And what we found over the 20 years that I've been working here, most people can manage not more than 1 milligram equivalent of Valium a month. So if somebody was on 10 milligrams Valium, then that's going to take them about a year to come off, because as people go lower, it gets a lot more difficult because you're taking out a bigger proportion. So it'll probably go slower as they come down. I think when you're in withdrawal, what you should avoid to help yourself get better is any obviously stressful situations, any other substances. So you can actually see, how much is the drug. If you introduce something else, that can be very hard to determine. But mainly, it's a case of, taking the energy and power back to yourself and putting yourself as the central component in this, instead of worrying about everybody else, which a lot of people have been doing, and feeling perhaps very guilty that they're in this state or they're not working. And so it's, maybe go for counselling once a week and have that time that you concentrate on you, and you really do have to make yourself a priority and your recovery and your healing a sort of number one consideration in your life. I think withdrawal symptoms can get misdiagnosed, because I think there's a number of people, medics included, that find it very hard to believe that this complete range of really dreadful symptoms can be attributed to a prescribed drug. And I think, until we get around that barrier, it is very hard to explain that, yes, these symptoms did kick in as somebody was starting to come down, and stopped when they, if they then took the dose again. So I think it is pretty clear, and that all the documentation we've got on it, when we can see it as a withdrawal syndrome.
Prior to the drugs, I had a full life, I would say, both personally and professionally. Professionally speaking, I had been always been in IT and IT sales. I had been steadily building a career by developing more and more senior roles within that career. In my personal life, I was always very busy. I had a wide social circle of friends, and I was always involved in different sports. Played a lot of football, played golf, always down the gym and so on. So for me, typically, every day was pretty busy, and there was always something that I was involved in. The first drug that I took was Prozac, and that was back in 1995 when I was 32, and that came about as the result. The key trigger was a virus that I had, and it was pretty much a virus that was doing the rounds, but I just never seemed to recover from it properly, and typically what I was experiencing were mainly physical symptoms, so tiredness, fatigue, more easily fatigued when I was doing exercise or anything strenuous. I was on the Prozac initially for 3 years, and that was because of a number of things, but firstly because I tried to stop taking it several times, and I experienced what I now know but didn't know at the time were withdrawal symptoms. And because of those symptoms, I was advised to go back on the drugs on the basis that my issue, my problem was still not resolved. Eventually I was prescribed Effexor in 2004, really as a last resort after having cycled through and been prescribed multiple other antidepressants between 2001 and 2004. I can't remember which ones they were, but it was most of them that were available. None of them made me feel much better, and most of them made me feel considerably worse. I stopped taking the Effexor cold turkey, and then I experienced a wide range of symptoms, most of which I hadn't experienced before either taking the Effexor or in fact any of the antidepressant drugs or during the period when I was taking the drugs, and I now know that to be withdrawal. I had a period of probably 2 to 3 months of acute withdrawal, and then have had a period since then, and to date it's about 4 years of protracted withdrawal. During the acute withdrawal stage, I was pretty much incapacitated and spent most of the day just lying on the sofa. I've thought about this since then, and if I could think of a way to make somebody's life as miserable as possible, short of terminating their life, this would be it. It impacted me both cognitively and physically. So the types of symptoms I was experiencing were a severely degraded memory, severely degraded ability to concentrate, to retain information, to rationalise and understand information. Physically, I just was racked with pain from head to toe, joint and muscle aches and pains, dizzy spells. I developed intolerance to a whole range of food and drinks and so on, such that if I ate or drank those foods and drinks, that the other symptoms would ramp up as well. Headaches, blurred vision, I couldn't hear properly, balance issues, coordination issues. I wasn't able to read properly, so things like reading a nighttime story to my son in itself was a challenge, just getting through that. 4 years on now, where I am now, I would suggest I'm probably in the order of maybe 75 to 80% recovered. I'm just starting back to work now in a full-time role, which has its challenges, but I think it's something that I can now take on, and I've still got some time before I fully recover. But my overall feeling that I'm left with is that I'm just so angry. I'm just so angry that this, for something that never needed to happen, has happened to me. And it's affected me, both for things that I worked hard for. I'd never been involved in drugs, I'd never been involved in illegal, there were things that I was never interested in. And it was a legal prescribed drug that has effectively disrupted my life for over 10 years.
I really enjoy running. I've enjoyed it ever since I was younger. It's kind of the thing that I use to de-stress and to get fit, stay healthy. It really helps me at this time of the year when it's really cold and gloomy. It's the kind of thing that I look forward to. I was first prescribed benzodiazepines when I was at uni. I was in the last year, about to take my exams, and I became very, very anxious, as most students do in the last year of their exams. I stopped sleeping for about a week, and I was very worried about what was going on with me. I thought maybe I was getting ill or something was happening to me. So I went to the doctor, as you do, and I told him about this anxiety that I was having, and so he prescribed me a month's worth of lorazepam. After a while, I became so unwell after taking the lorazepam that I stopped seeing friends, I stopped eating, I stopped feeding myself, I stopped washing. I kind of felt one day that I should just stop taking them because it's no good to keep taking all these tablets. So I didn't know anything about the effects of stopping suddenly. I didn't know anything about withdrawal. So by this point I was on 60 milligrams of diazepam and I stopped cold turkey. It was probably one of the worst decisions I've ever made. After I went cold turkey, I couldn't eat, I couldn't swallow, I was so anxious all of the time. I was staying with my mum at the time, and I walked around constantly asking her, am I going to die? By the end of the second week, I was unable to sit down. I was pacing from floor to floor, and I was going up to my mum and dad and saying, when is this going to end? When is it going to be over? And I'd ask them that day after day after day. And they didn't know. They were absolutely terrified. They didn't know what was happening to me. At this point, a psychiatrist was still coming around seeing me. And he told me it can't be due to the withdrawal. It must be due to some underlying mental illness. And so I kind of worried that I'd really damaged my brain in some way and that I was going to be stuck like this forever. I first started getting my windows and waves, which is what they call, which is what they say happens, after about 4 months. And I remember my first window where I got some relief, and it felt so wonderful. And I'd forgotten actually what it felt like to not have anxiety, to not be crippled with depression, to be able to get out of bed. And it was very short-lived, but it reminded me that that could be a possibility again in the future. So it took between 8 and 9 months after I stopped cold turkey from diazepam to feel any better at all. I still suffer with some anxiety that I didn't have before I started taking benzos. And I still have the ringing in my ears, which has never kind of gone away. The insomnia is still a problem, but I can definitely say that things are very much improved. So my future plans at the moment are to become a forensic psychologist. Psychology really interests me because I've been through my own experiences, and I'd really like to go on to kind of help people in distress. Looking back at my experiences now, I feel so angry that no one explained to me what withdrawal from benzos was like, and all the doctors that I tried to talk to about it just didn't know anything about it at the time. And I feel like these drugs, people should know more about these drugs before they're taking them. I feel like I would never have taken them had I known what lay ahead of me.
At the moment, I'm manager of the London Hearing Voices project at Mind in Camden, which means I get to run a project that works with lots of people around the whole of London that hear voices. We work in prisons, we work with children and young people, we work with people with difficult beliefs. We kind of promote peer support groups where people come together, share stories, and really find a way of kind of making sense of their experiences. If you'd have met me a decade ago, you'd have seen someone very different. I wouldn't have been able to speak to you like I am now. I'd have been looking down at the floor, I'd have been really anxious, shivering almost, and I'd tell you that I was schizophrenic and that there was no hope for me. The turning point for me was, there was lots of turning points, but some of the big turning points were meeting people that actually wanted to hear my story. I went to a Hearing Voices group, part of the Hearing Voices network, and met these other people that heard voices that were human beings, you know, real people that were trying to cope with it. And for the first time in ages, I started to feel like a real person again. I started to connect with others. I started to realise that maybe my voices made sense. Maybe it's not an illness. And just hear these alternatives that have been so formative in my life. I think that's what got me from the ill schizophrenic with no future to the person I am today. It's World Hearing Voices Day on the 14th of September, and last year I created this for Intervoice, the International Hearing Voices Network, and it's a series of postcards that are statements from voice hearers across the globe. I mean, one I love in particular is Eleanor's, and that's the voices took my pain, took the place of my pain and gave words to it. But this one's from guys of different ages, different cultures, and we're really trying to spread these around in social media. I was about 18 or 19 at university, and I was starting to really struggle. There were voices that were speaking to me. I believed I had an alien inside my body, that I was part of a conspiracy. I wasn't even really able to eat because I thought I was being poisoned. I went to my GP because I was self-harming to cope with all this distress, and they put me on antidepressants and everything, but then sent me to see a CBT therapist for anxiety. Of course, I didn't tell them about the voices or the aliens, but it was this psychologist that really noticed that something really wasn't right for me and got me to see a doctor, a psychiatrist. The psychiatrist was lovely. He basically, once I told him what was going on for me and once I opened up, he said, it's okay, we know what's wrong with you, just come into hospital. A lot of young people go through this. We'll get you on some medication and we'll get you back out to university. You'll be okay. They were almost like the worst words he could have said to me, I think, because then I spent the rest of that 8-month admission and the next few years just waiting for it to be true, waiting to go back to university and waiting for everything to be okay, but it wasn't. Eventually they diagnosed me with schizophrenia. Later it became schizoaffective disorder. They added borderline personality disorder onto it, bipolar psychosis, then back to schizophrenia, and this whole kind of array of labels kind of followed me around. I think looking back at hospital, it's actually really traumatic, both for me and for my family. I mean, my parents still cry when they talk about hospital because they were made to feel as if it was their fault. There were times they described where I wanted to leave the hospital. I wasn't sectioned, I was allowed to leave, but the staff wouldn't let me, so they barred the doors, and there was almost like a tug of war between me and my parents, and eventually I was released with no medication at all. So there was all these really huge situations. But I think for me, the biggest miss really was that I was a traumatised young person who was ready to ask for help, finally. But instead of someone sort of sitting me down and going, okay, so Rachel, what's happened to you? How did you end up in this position? You know, who do you think the voices are? What do you think's going on? Instead of someone trying to make sense of my experiences, I got a label, a diagnosis of schizophrenia and then schizoaffective disorder, and I got given up on, I think. The only cure, the only solution, the only help offered really was medication, and that's really the last thing that I needed at that time. Some of my other passions, I guess, are music. I'm a musician, so I sing, I play guitar, I gig when I have the time. I write songs that are based in my experiences, so music used to be a big coping strategy for me when I was younger, and it used to help me live, really. It was my survival strategy. And now I've learned to deal with my voices. It's now just fun. It's something I enjoy. Oh, and I wanna fall, yeah, I need to fall for you. There isn't anything wrong with me. This is probably going to sound weird because I've just been telling you that I hear voices, I've got visions. You know, I'm a poster child for psychosis, but actually I'm just a survivor of some really horrible childhood experiences and trauma, and my voices and my visions are kind of metaphors. They're kind of almost the links to those horrible things that happened to me. They're the way I coped as a child, and to call that an illness is deeply, deeply disrespectful, because it's basically saying there's something wrong with me. You know, just like an abuser said there was something wrong with me when they hurt me. It's the system saying there's something wrong with me. It's not an illness or a symptom, it's a survival strategy. And to call it an illness just left me with no hope and no way forward, really. If I could go back and speak to the psychiatrists that treated me when I was in hospital, I think I'd like to just sit them down, really. I'd like to sit them down and just ask, why is it that they don't look at the evidence? Why is it that they treat people like me with medication primarily? Why is it that they label people like me with schizophrenia? Why don't they look for the reasons, the true reasons that are actually there, rather than some mythical chemical imbalance? What is it about them? What is it about their training? What is it about society that won't let them look at the real me. Why did they have to force me into this schizophrenic box, and why won't they listen?
The sugar makes the madness sleep, so give me sugar to make the madness sleep.